I'm Dr. Brian Nickel, your cannabis expert for CannabisExpertMD.com with part 4 of our series of post-traumatic stress disorder, how to use cannabinoids to treat it. We've discussed the criteria for PTSD, the symptoms that commonly occur. We've discussed how to treat the insomnia and nightmares that occur with PTSD, how to treat the panic attacks wherever they may occur with PTSD. And on the last of this series, I'd like to discuss how to control the baseline anxiety and depression symptoms patients with PTSD experience most of the day. For this particular symptom with PTSD, we're going to look to CBD as the cannabinoid of choice. CBD has activity on two systems in the brain, exclusive of the endocannabinoid system, that are common targets for drugs that are normally prescribed to treat PTSD symptoms. That would be the serotonergic system and the gamma-aminobutyric acid systems of the brain. Very oftentimes, selective serotonergic reuptake inhibitors are prescribed for PTSD patients. These work on the serotonergic system of the brain, of course. CBD has activity on the serotonergic system of the brain. It works a little bit differently, but does affect it in a similar fashion. The GABA system of the brain is a target for benzodiazepines such as Xanax, Valium, Ativan, clonazepam that many patients are prescribed for anxiety disorders. Now, CBD also has activity on the GABA system of the brain, a little differently than the benzodiazepine class of drugs work, but activity on it nonetheless. By using CBD in patients with underlying depression and anxiety disorders, we affect both of these systems in the brain, improving their symptoms. So, for most of my patients, I recommend a CBD tincture as the most efficient way of obtaining those medications. Tinctures are more potent and longer lasting. Their symptoms are present pretty much all day, every day. The initial dose I suggest to patients is between 8 and 16 milligrams a day, twice a day of a sublingual CBD tincture. It should be a full spectrum product. I usually recommend patients keep a journal of their symptoms over a period of time to show improvement in their symptoms, and then modify either the dose or the dosing interval based on this. Usually suggest patients wait 4 to 7 days before they look at their journal and make a decision whether to increase the dose or go from twice a day dosing to 3 times or 4 times a day dosing as required by them. One of the important things to consider when you're using a CBD tincture for controlling anxiety and depressive symptoms is to be sure to use a little bit of inhaled cannabis right around the doses. That is, at the time of administration and 45 to 60 minutes after the first dose of CBD was given. This ensures that you will have THC circulating around in your bloodstream at the same time the CBD cannabinoids are being absorbed. Most of my patients who I've had used this technique experienced a markedly improved response as far as anxiety and depression goes, along with a decrease in the number of daytime trigger events that do occur. So, when we're talking about treating PTSD, just to wrap things up here, I'm going to suggest that you use a CBD tincture twice a day with a little bit of inhaled cannabis around the doses, that is at time of administration and 45 minutes later. You don't have to be intoxicated as a result of this. Just get some THC in your system. It's going to be a baseline symptom control. For the insomnia and nightmares that occur at night, inhaled cannabis at a higher dose range is required. I'm suggesting high linalool strains. Glue ball or Gorilla Glue would be 2 strains would be very appropriate for that use. For treating panic attacks, I point most patients towards a 1-to-1 vape cartridge just because of the stealth factor involved with it and the rapid onset of symptom relief. I also advise my patients with PTSD to avoid any strains that are dominant in the pinene terpene. I usually advise my patients with PTSD to avoid any flower strains dominant in the terpene pinene. Pinene has a tendency to precipitate panic attacks and anxiety in patients with PTSD and some patients with just underlying anxiety disorders. I hope you found this useful and informative. I encourage patients with PTSD to give the little protocol I have together a try. Most of my patients see significant improvements in their symptoms adhering to this. For more information about medical cannabis, post-traumatic stress disorder, and other conditions, we're available on CannabisExpertMD.com, CannabisExpertMD under Facebook, Instagram, Twitter, and now YouTube. Look forward to seeing you again.